time, ultimately driving better outcomes for HCPs and patients. Before we begin, a few brief housekeeping notes. Today's session will conclude with a Q&A for our panelists, you, the audience, and you can submit your questions at any time during the presentation. We will do our best to get to them all at the end. The webinar will be available on demand to all registered participants shortly after it concludes. You'll receive an email about accessing the recorded webinar, which you can also share with your colleagues. We'll be live posting this webinar on Blue Sky with the hashtag #PPWebinar. Please feel free to follow along and join the conversation. Now, without further ado, let me introduce today's panelists. Liisa Caliendo, Senior Vice President of Global Product Strategy and Marketing at Medscape, is a highly accomplished marketing and communications leader with more than 15 years of experience in global product and marketing roles. Welcome, Liisa. Michael Brandreth is Senior Vice President of Global Sales at Medscape. He's been with the company for more than a decade, and in his current role, he works closely with healthcare organizations to drive real, measurable changes in clinical practice through a mix of promotional and educational programs. We have Justin Freid, Chief Media and Innovation Officer at CMI Media Group. He works at the intersection of people, technology, and data to fuel growth. And during his current tenure at CMI, he's been instrumental in the growth of the company's award-winning media capabilities. And last but not least, Kelly Smith is Chief Executive of FOR's Healthcare Sector Services. She has 20 years experience leading teams and driving innovation and is a leading healthcare strategist in developing UK and global integrated healthcare professional and patient-centric campaigns. Welcome all of you. Thank you so much for joining us.
Thank you.
So, first of all, omnichannel as a term has become so ubiquitous in the last few years that it almost seems meaningless sometimes. What do we mean when we talk about omnichannel in 2025, and why is it still important? Let's start with you, Liisa. Oh no. I'm so sorry, Liisa. We've lost your sound again. Why don't you try going in and coming back? And maybe we can start with Justin, and then you can jump in afterward.
Sounds good. All right. So thanks. So when we think about omnichannel, I was actually in a conversation the other day where they said it was the most used buzz term until AI came about, and now it's been a little bit replaced. But I think omnichannel, kind of covered the marketing space for about a 3 to 4 year period. But at the end of the day, whether it's a buzzword or not, for us and for me, it's about delivering a seamless experience to that customer, whether that's an HCP or a patient. It's understanding what they need. It's understanding what message they're likely to respond to and on what channel. And if you're able to provide that, that individual is going to have the information they need, and they're going to have positive experience. So they will favor your brand positively. And I think no matter what, if you deliver that experience, it ends up being a net positive for your brand.
Liisa, do we have you back?
I sure hope so. Can you hear me?
Excellent.
Great. I hope this lasts. I think it's a good question. Justin, I'm sorry I missed what you said, but I do think that this word has been circling around for a while. A lot of talks on it. A lot of focus is on what does it mean? What should it be called? But I think really the focus should be on customer centricity and where are the people that you're trying to meet and how can you have the most positive and respectful interactions with them. And I think a lot of us will echo this throughout the morning. It really is about meeting them where they are in the right moment, and not necessarily just being everywhere you possibly can be. I think that leads to a lot of wastage and a lot of wasted time for a lot of people. So I think it's really should be focused on being efficient and being in the right place in the right moment.
Kelly, anything to add?
Yeah, absolutely. And I totally agree with everyone. I think we've been using the term omnichannel for a long time, but actually the reality of how we deliver it, I think there's a lot of challenges there. How we connect different channels. Really, is it a true omnichannel process? And I think the ambition of when we start something isn't always what we get at the end. So I totally agree. I think it's not just about omnichannel, it's around that kind of custom channel and making sure that it's always based on customer and customer centric. So yeah, agree there. I think it's a real buzzword, and I'd like a new one, please.
So how do you all approach audience segmentation when you're planning these omnichannel strategies, especially for HCPs across different specialties and different geographies? Justin, let's start with you.
Absolutely. So I think, in order to deliver omni-channel and to kind of hit on what Liisa and I just spoke about, you do need to have some advanced segmentation that helps you understand what message needs to be delivered. So we look at different things like script writing behavior. So if you're in a drug launch, we may look at how that specialty or doctors within that specialty, HCPs within that specialty how long it has taken them to write new launch drugs. That may tell us who innovators are, who laggards are, who's a wait and see type approach. That accompanied by, and I know we're going to get into this a little bit, so I won't go too deep, media consumption behaviors, how these individuals like to get information, whether that's long form, short form, social, video, email, etc. All that is extremely important and can help fuel different segmentation. So you're hitting people with the right message and hopefully moving people up to that top segmentation of writers.
And Kelly.
Yeah, and agree again. I think we always look at starting with what are the actual business outcomes. I think sometimes what can happen is you get a bit too focused on creating lots and lots of different data points, but actually what are we trying to do at the end of it? And here at Forum, working with different partners like Medscape, and we look at really what are those kind of business ambitions and what the commercial goals are, and really kind of focus on that to create a journey. So absolutely, I think it's about getting those data points, understanding where people go and behave, but actually always linking it back to the objective, which sometimes I think can get lost in the weeds of trying to be everywhere.
Absolutely. Anything to add, maybe Michael?
Yeah, absolutely. I think whether you're an agency or a publisher or you work in pharma, I think you have to start with what you know about the audience. We have the ability to apply some pretty sophisticated strategies to improve relevance, frequency, and delivery. It always also depends on how much time you have. And it's one thing, if I could urge pharma or agencies, when you're working with a third party, when you're working with a publisher, is to bring us in earlier. And we sit on an awful lot of first party data, all publishers do, and that can help with the development of whether it's segments, personas, journey planning. It's not something we would charge for. So whichever partner you're working with, push them and see what data they have that can improve the eventual outcome of the campaign.
In your experience working with these different HCPs, looking at these different audience segmentations, how do the communication preferences differ, and how can you move to accommodate these different preferences?
That's a big question, Jonah. It's a really big question. I mean, HCPs are no different to any other audience. Believe it or not, doctors are normal people with different attitudes and perceptions and habits and learning styles. They use different devices and channels. And with all those differences, they do vary by region and specialty. But I think sometimes we forget that there are many similarities in behaviour and information needs as well. But going back to what I said earlier, it's understanding the differences in behaviour and those preferences that I think is absolutely key to the success of any marketing or educational campaign. And there's a number of ways you can improve that understanding. There's a number of ways you can accommodate those preferences. I know that For and CMI have their own access to data sets. At Medscape, we sit on millions and millions of behavioural signals that we can mine from the network. We can go out to audiences. We can ask questions. We can run surveys. I think in the US, there's a certain richness of data sets that you can take advantage of. But I think increasingly, certainly outside of the US, increasingly we're looking at those types of decision-making engines that can deliver content or format preference based upon the individual need. And maybe later on, Lisa's the head of our product team, so she can talk about that in more detail. But ultimately, it's understanding the audience and accommodating their preferences from that understanding.
What do you think, Kelly?
Yes, and I agree. I think it's about getting those data points, whether it's through surveys, and Mike's absolutely right. You know, a lot of agencies will have their own data sets, and we're trying to go beyond that as well, and using a lot of kind of real-time AI as well to kind of keep tracking these data sets. I think what we often do is do a great piece of work, right, and do it in 2 years ago, and still are using that data to make kind of critical choices now. But I think it's about always updating it. We're in a very interesting, changing landscape in how we connect with healthcare professionals and clinicians. And I totally agree that will change moving forward as more channels become available. And just the way people engage with healthcare changes. So it's a changing feast. So it's something we should be doing all the time.
Jess?
Yeah, I'm going to double down on what Michael said about bringing your partners in early. I think that's really important, whether that's your publishing partners like a Medscape, or even your creative agency partners. I think one of the barriers that we run into is we have these changing shifts of consumer behavior. And as Michael said, like, an HCP is a consumer. They are listening to podcasts. They are watching short form videos on social media. They are not always picking up a magazine, right? Or some type of scholarly article. So it's important to understand those media consumption behaviors up front and have the right creative to meet these people where they're at, as Liisa said earlier.
What are the most effective ways to deliver this critical information to HCPs, especially if they're, time poor, overwhelmed by the digital noise? Liisa, let's hear from you.
Sure. I think this is related to the segmentation question, right? How are you creating those segments, and how are you targeting those individual users? I think part of that has to be, how do they prefer to engage with you or with certain content formats over time, right? It's not just about what they happen to be doing in practice. It's about how they like to interact with you. And it's also really recognizing that you're not going to have that physician's attention for an hour long, or maybe even for 30 minutes. They may have chunks of time throughout the day, very small chunks. And so each interaction has to count. So I think it is about taking a step back. Like Mike said, they are people, they are consumers, and their time is very valuable. And so every interaction we have with them has to be meaningful, and it has to really count. So if you grab that, whether it's 10 seconds or whether it's 5 minutes, that has to be exactly what they need and what's relevant to them at that time, and in the way they like to engage with you. And I think that's where the real impact happens, when you kind of meet all of those points for the physician at that right time, and get them the right information so that they can practice the best medicine for their patients.
Liisa? I mean, Kelly, sorry. Thank you, Liisa.
Okay. So yeah, I agree. I think it's about creating kind of effective moments of how we engage with people. We do a lot, and as we talked about behaviour change, I think earlier, and about how we're changing behaviours, and we do a lot in that. And I went a bit old school in how I kind of approach it. There's a very historical way of doing it, and it's just called EAST, right? Is it easy for them to engage with? Is it attractive? Do they want to engage with the content? Is it social, so that they can actually share it with their colleagues, which is super important, right, for us in peer-to-peer? And is it timely? Is it in the right space in the right time? And I think if you follow those principles, you can make sure you're having those kind of meaningful moments, whichever the platform. So yeah, I always kind of look at that. Would I want to engage with it, right? In that space.
That's great. I love a mnemonic.
I
So
do too. I've
those
got
people
loads of
didn't
them.
get to write it down. Easy,
Yeah.
attractive.
Yeah, social and timely. Yeah.
Justin.
Yeah, so I like to think of this from behavioral science, and there's a time and the place for communication, specifically with priming and prompting, right? So if you understand the HCP journey and how an individual goes about prescribing a drug, there's a time to prime them. That's reminder messaging, display ads, maybe an email here and there to ensure your brand or your disease state education stays top of mind. But then there's the prompt. The prompt happens at a specific time of action. Maybe that's an upcoming appointment with a patient. Maybe it's checking some dosing information or going and doing some continuing education. And that's when you deliver the more in-depth, deeper message that gives them what they want. And I think that is a key way to stay top of mind, not over communicate to them, but be there when they need it.
So I'm going to cut in real quick and just remind everybody that you can submit your questions anytime. And we'd love to get some questions going now so we have them all locked and loaded, and we can get to the Q&A in a little bit. So there's a lot of things you have to be thinking about when you're building these campaigns. How do you balance making it personalized to each HCP, keeping up that HCP trust, but also making the campaign scalable and doable on that logistical side?
Yeah. The scalability, I think, is definitely one of the more difficult barriers to entry for omnichannel. You can get extremely granular, deliver personalized messaging, but being able to do that to, in some case, tens of thousands of HCPs across the globe, right? Hundreds of thousands. It's difficult. But I think one of the key things we tried to deliver to HCPs is the value that the brand brings. So understanding the key differentiators of the brand against its competition, and then making sure those are highlighted. Because when it comes to trust, people do get annoyed when they see the same ad over and over again, especially if it is not relevant. But if it is relevant information that provides value, that trust will build. And I think that's a key part of executing omnichannel.
Absolutely. Kelly?
Yeah, I think it's a big balancing act, right? It's not about being everywhere. It's about being in the right place. And I think that can risk the trust factors when we're trying to be in too many places at the same time. I also think as well, how we communicate is super key. I going back again, kind of old school. I remember when pop-ups became a thing, this was like 10 years ago, and then everyone was annoyed by them, and we had to look for different ways to engage. The engagement wasn't great. So I think it's just about making sure that we complement their professional working day and not be intrusive or annoying, just instead of annoying, or annoying with it as well. So, and again, I think that builds trust, that builds engagement and keeps engagement, because that's often what happens when it kind of falls down, and we have to look at different ways.
Liisa?
I agree with everything they just said. I think part of the trust comes in also, or a large part for us, over the past 30 years, our members have trusted us to bring them accurate, truthful, relevant information at every point in time where they've needed it. And it's that reliability and accuracy that's allowed us to build our membership network and keep it. It takes, it's taken us 30 years to get where we are. It would only take a second for us to lose that trust if we oversaturated our users, if we gave them inaccurate information. So there's a ton of ways that we could fall down, but only a few where we could stay where we are. And I do think personalization comes into that, because that's definitely making sure that we're staying relevant to our users and delivering them, again, the most accurate information. We've seen a lot of growth and increased activity with personalization. It really does matter that we're giving, the information to our members based on what we know about them, right? So again, that information that they've shared with us, and we can turn around and then deliver them the most relevant information.
In addition to the variation between different HCPs, even with one HCP, they might have different needs at different stages of their HCP journey. How do you ensure that content is always relevant to, as we say in the title, meet them where they are? Let's start with Michael.
I'm going to sound like a broken record, but you have to have some understanding of the audience. You have to have some understanding of it's over and beyond a simple specialty level to ensure that relevance. But I don't think it necessarily needs to be a complex process. And I mean, we would recommend starting by ensuring where possible and where appropriate. It's not always that some kind of journey is built into each campaign, and that journey could be pretty sophisticated. It could be based upon a myriad of complex behavioural insights, but equally it can be much simpler. Sometimes you have to walk before you run, and it could be a trigger that's based upon something you've done online. It could be a trigger based upon an action you've taken or a piece of content consumption, a trigger that actually then gives you the next message in that sequence. And I think it's important at a base level, we try to build in that type of action-based triggering into all of our engagement products. And I think that's a really smart, and it can be a simple way of ensuring that relevance across the journey.
Justin?
Yeah, I think to build on top, I agree with everything Michael just said, and to not just repeat what he said, I'll go to another area we look at, and that's the competitive set. So understanding where your brand wins and understanding where your brand loses, whether that's efficacy, cost, access, and things like that. You're going to need to know when in the journey that Michael spoke about, those things become important, and have that creative, have that messaging ready to be triggered and delivered. I think that is absolutely key. So again, working with data providers, your publishing partners, and your creative agencies early on to have all that set up is key.
Anything to add, Kelly?
No, not really. I think it's been pretty covered about sort of right place, right time. It's the basic principles of marketing, whether or not you're in a consumer space or not. It's about making sure that we understand that journey and that it's super relevant. And I think as well, it's about making sure that there's something in it for them. Again, the kind of principles of marketing, that value exchange. And by engaging with content, they're actually going to get something out of it, whether or not that's education or whatever that call to action might be. So no, I totally agree. I think and I think working with all partners and all stakeholders, Justin, you were mentioning creative agencies, and I often think that always links too late as well when you're in that media space, actually what we're going to deliver in that real estate. So I think, again, it's about linking those journeys, and it doesn't have to be super complex. I agree, Mike.
We already spoke a little bit about that trust factor, but I think it's worth it's worth zooming in on that, a little more. Why is it so important to sort of build trust between pharma, the publisher, and the HCP? How can you build it, and how can you guard it? You can start with Kelly.
Where do I start? I think it's a super kind of complex one. I think it's about trust when it comes to trusting the information. Again, that's a whole, we work in a very highly regulated industry, whether or not that's scientific credibility, making sure that we're getting the right details, that it's totally transparent as well, so that their privacy is going to be respected and their data is going to be respected if they're engaging with content. I think it's just about building that kind of transparency. I could talk about this all day, I'm sure, but I won't. But I'm sure other people have other things to add.
Sure. So I can jump in. I think this is an interesting one, and I think it can be very important for companies who are entering into a new disease state or therapeutic area. We know HCPs can be creatures of habit, and if they're used to just prescribing, oncology drugs from one of the top oncology companies across the globe, they have a lot of trust in those individuals. But as we've seen over the past couple of years, there's lots of companies expanding, getting into GLP-1s, getting into oncology, getting into, to be honest, where they can help patients the most. They have to build that trust as the parent company, not just with the brands. And I think one of the key things to be able to do that is to be delivering messaging through trusted publishers, where HCPs know the information they are getting is true, is correct, and is valuable. And I think those three things together could help somebody launching into a new therapeutic area gain that trust from HCPs faster than maybe some unbranded disease state kind of education.
Michael, you want to?
Yeah, I think from pharma's point of view, I think it can be difficult to build a trusting relationship. Pharma isn't seen necessarily as an independent source of information, but it can be achievable. And I think it can absolutely be achievable if you have a fair and balanced value exchange of content and information. I think that's absolutely essential. I still see behaviours within the world of pharma marketing that I think should be avoided if at all possible. I think pharma could probably still do a better job in recognising how and why HCPs behave and where they prefer to consume information from the industry. I hear a lot about customer centricity, but I still see too much out there that is, I would class as pharma centric. What pharma wants that doctor to consume and where. But I think in any industry, it's not just the pharmaceutical industry. If it's not on the audience's terms, then you're not going to drive the best outcome. So I think it's incumbent on pharma to build that kind of trusted relationship, and that for me is through a fair and balanced exchange of value.
So I want to ask some questions where we kind of get into your guys' personal experience and really share, some of what you've learned, what you've experienced. What are some of the most important lessons that you've personally learned in your career about engaging providers? We can start with Liisa.
Sure. I think I said this earlier, but it's never take our members or HCPs for granted. Never assume that one day is going to be the same, that everything's going to kind of stay steady. I think the way I've worked through this industry is to really prepare for the unexpected every single day. And while there are a lot of things we can count on day to day, things are changing pretty rapidly in our field, right? Not just in medicine, where we're seeing medical knowledge double every 73 days now. But even in the way we're able to communicate, it's changing so fast. I mean, you can make an innovation and 3 or 4 months later, it's out of date and you need to work again. And so I think it's a constant learning experience. It's a constant exploration of how we can best support our members, how we can best communicate information. I think a good example of that, AI is a real buzzword lately, and there is a lot of AI out there where some of it's helpful and some of it's just extra, but I think we've really explored releasing AI for our members, and have just recently relaunched our Medscape AI search, and that is now enabling physicians to come to our site and search guidelines, all of our editorial content, third-party journals, all within a couple of seconds, and getting those answers back. And that's something that used to take them hours of studying and searching to do. So I think our industry is changing so fast with now how we're getting that information out, that, I mean, again, no one day is the same when it comes to supporting HCPs and treating their patients.
I think I saw that press release about that just yesterday, and we might have written it up. So just to your point of how quickly that landscape is changing. Kelly, how about you? Lessons you've learned?
Yeah, I'm in a quite unique position. I think I've worked both in publishing. I've worked in medical publishing and on agency side. So I think I can kind of see it from both sides. And I absolutely agree with Liisa. Your users are your kind of core focus, right? And making sure you're retaining those and giving them something, again, that adds that did I call it earlier, that kind of complementary points of their professional day. So I think that's kind of really key. But in my career, I think it's always about being very transparent, data-led, making sure that we're always able to provide those details, but really working with partners as well to always keep ahead of that innovation and just kind of like tracking the changes that are happening in the landscape. So those are kind of my key takeouts from both sides of the fence.
Justin?
Yeah, I think it's finding a way to stick out. These HCPs are served a ridiculous amount of content, whether that's for pharmaceutical drugs or everything else that goes along in their life, and pushing ahead. And I actually would like to think back to I think it was 2022. I was having conversations with individuals from internet brands who are are the parent company of Medscape and PulsePoint in the US about programmatic for ex-US and global. And it fueled a bunch of conversations. And now, Medscape has this great product, right? Medscape Extend, which is a way to stick out from the competition because everybody was doing the same thing. They were doing print, they were doing some endemic display, and all of a sudden we had a new way to communicate and stick out, the brands to stick out from the competition. And I think something like that around innovation is key.
Mm-hmm.
Thank you so much for all the questions that are coming in. We're going to get to those in just a moment. I'm going to ask one more of my questions, and we'll save our question 10 for the very end after the Q&A. So what, in your experience, are the biggest barriers to reaching these hard-to-access HCPs? And what advice do you have for overcoming those? So start with Justin. Yeah.
Sure, thanks. So it's very interesting. And I think we look at hard to access a couple different ways. I think the one I'm going to answer this question on will be about rep access. So we know that usually hospital-affiliated doctors and oncologists tends to be the ones that getting a rep in there to speak with them, and their schedule is very hard. So that's where we do heavy up on digital, and we'll do more push factors, so sending more information to them, than more pull factors, which is, they're going to a website and we see them. So we are pushing more content out to them to make sure we're consistently getting that message. And the great thing that you can do is understanding that engagement data, right? On what are they actually engaging with? What type of content are they receptive to? And then that, of course, feeds that omni-channel effort that we were talking about, so we can heavy up on the messaging that they're most responsive to. So digital plays a huge, huge role in those hard to access HCPs.
Kelly, anything to add?
I'm going to just be a bit controversial and say I don't think anyone is hard to reach anymore if you get the right user journey. So I think typically when we would say, hard to reach, again, it's, as Justin said, about not being able to get face-to-face. But there's so many touch points now where we can engage people. If you get that right, there isn't anyone that you can't access. I remember a few years ago, we were looking at reaching a certain group of doctors in a very rural community. And we ended up actually doing some kind of on the ground connection and kind of social activity. So there is ways around being able to do that. So I don't think there is hard to reach audiences anymore. But I do think as well, it doesn't always mean by channel, but it can mean by environment, and it's about finding those innovative ways to engage them. So yeah, that's I think hard to reach is a word we should not use anymore because we can do it.
Liisa,
why don't you bring us home from the Medscape perspective here?
Yeah, I mean, I agree with both Justin and Kelly. I think that even a year and a half ago, I would say that wasn't the case, right? Your only option, at least in Europe, was to reach physicians through email or through your registered member platforms. And with Medscape Extend, that was the first time that we could really start to reach HCPs outside, in their regular consumer digital journey on any website. And so I think now everyone truly is reachable. I mean, everyone is online at some point in their day now. And so there are endless touch points to be able to reach out and have that conversation with the HCP now.
Great. So I'll go ahead and move us into our Q&A portion. We've gotten some great questions in. First of all, Rohit asks, are there any examples you've seen of 100% digital launches? So no face-to-face, all orchestrated through emails, programmatic advertising, etc. So have you seen that? Do you think face-to-face is still important? And how do we expect that to evolve in the future?
I can answer this one if that's okay. This is something we've done. So first off, I think to answer the second part there, yes, face-to-face is still extremely important. Relationships, no matter what you are selling, are important, and you're going to be able to use that relationship to gain trust from the HCP. So that's always going to be important. If you have the funds available to do that, it's something worth investing in. That being said, we have worked with clients on digital-only launches. We actually have a program that we call OTA, or Own the Audience, where we invest in digital-only communication to a set of HCPs. And we buy all of the media. The client's not paying for the media, and we share in the revenue gain. So it's tracked, and the revenue generated from the scripts driven from those specific healthcare professionals is shared. And that is digital only. And so, yes, it is 100% doable. It can be 100% successful. That being said, it is one of those things where a significant amount of data and analysis is needed up front to understand basically everything we've talked about. What barriers to entries will the HCPs have? What creative will be needed? What media consumption behavior do these HCPs have? So it's quite complex, but 100% doable.
Anyone else want to add anything?
Yeah, just to agree. Yeah, it absolutely is doable, and I think we are probably now seeing with the post. I'm still talking about COVID, but post COVID, when the kind of sales CAM sort of model changed, then I think actually this is really where a lot of companies are going about those kind of digital engagements. So yeah, we've definitely seen it, and I think it will start to happen more and more.
So another question here from Hillary. Recognizing that HCPs are humans, to what extent should pharma marketers challenge our established norms and start to behave more like marketers from outside pharma in terms of meeting the customers where they are, provided the message is relevant and valuable? Anyone want to take a crack?
Yeah. Are they human? I don't know. Mike, are you going to come in? I think
I'm not answering that, Kelly.
No, absolutely. And just a short point on that. I do think we can learn more and more from that consumer space. Going back to, I mentioned earlier, it's the basic principles of marketing. And I sometimes think we can try and create overly complex journeys when we don't need to, when actually the principles are the same. So how we can learn from that, I think we should apply more to our campaigns.
Yeah, and I can add, I think one of the other key aspects is not HCP versus consumer, but it's generational. So you have a significant amount of HCPs joining the workforce who are under the age of 35. How those individuals consume content is significantly different than a 62-year-old, right? And it is important that you are shifting from those pharma norms of display and print and start getting into video, start getting into audio, start being on connected television where appropriate. It's paramount if you're going to break through the noise that all of these HCPs go through on a daily basis.
Justin, you've actually sort of preempted another question we got, so I'm going to read that one real quick and see if you feel like you answered it, or if you want to add anything else. But Ritesh asked, I also see that without access to mentors within health systems, the younger generation, junior doctors, is using other information channels that we would not consider official, TikTok, ChatGPT, Siri, etc. Do we need to take that consumer-oriented behavior into account?
Yeah, absolutely. And I would even say that's not consumer behavior. We're seeing it with HCPs. That's just natural behavior for these individuals. So I think one of the biggest areas of growth we've had as an agency is in the influencer space, and specifically on the HCP influencer side of things. These individuals have large followings. Not only do they interact with potential patients, but they also have a significant following of HCPs. So that is absolutely a key area that we're focusing on to make sure messaging can be delivered through those channels to the right individuals. And the other thing I think ChatGPT was mentioned in that. I'm a huge fan of open evidence and what open evidence has done in terms of using generative AI to answer questions. And I'm super excited also about what Medscape just launched and what they're doing as well. So like I think it is a positive to have these tools at an HCP's fingertips where they can get the information they need really quickly in a concise manner to make a prescribing decision. So I'm super bullish on the LLM ChatGPT version, catered though to HCPs.
I think Joe, it's all about offering choice. I think the days of a single tactic push campaign from pharma, I mean, they've gone. They still happen. Probably happen a bit too much still, but we have to take into consideration the different learning styles and the different communication channels that we have out there. I mean, AI is just going to explode everything, and I think marketing teams that don't take that into consideration, I think will fail.
So we actually did have a question about AI, so let me throw that one into the mix. AI, this is from Craig. AI seems to be the new buzzword everyone's tossing around lately, but I love how Dr. Susan Dorfman described it as a volleyball of support that helps keep our day-to-day work moving. From your perspective, how is AI actually helping agencies and publishers create a better balance, supporting smarter ways of meeting physicians online rather than adding more pressure?
So I guess I can take a stab at that because Susan Dorfman's my boss. Susan Dorfman's the CEO of CMI Media Group. Phenomenal woman and super smart when it comes to this stuff. I like that analogy. Again, I think what it kind of touches on what I said before, right? One of the things that generative AI is helping us all with, and large language models are helping us all with, is getting concise data-led information to us faster. Okay. For me as a marketer, if I'm looking at a campaign, I want to understand where the biggest opportunities are. This AI processing this data and giving that information in a concise manner allows me to be smarter and make better strategic decisions. It's the same with healthcare. If an HCP can analyze hundreds of thousands of data points in a short period of time and get more information to help a patient's treatment faster, that's a huge improvement. So it's almost like having an assistant there working at rates we've never seen before. So ultimately, I believe it's going to help us deliver better healthcare.
I would agree with that, Justin. I think it's really exciting, and I think the generative AI is a game changer for HCPs worldwide. But I also think it's a game changer in terms of how we can actually deliver that content. So if you're talking about analyzing millions and millions of records in a fraction of a second, or even just a couple of seconds, we can analyze those data points and determine what that physician may actually be most interested in at that time, right? So we have an orchestration platform called Medscape One that does just that. And it's using the same type of technology to say, I know this physician is more likely to engage in this type of content or this type of format when they're taking these kind of actions. And so it's really hyper personalized content delivery. And I think that's a really compelling use of AI to, again, make sure we're maximizing that moment, maybe even those just a couple of seconds or minutes that we have with that HCP.
So we have about 5 minutes to go in the Q&A. We've got 2 more questions. Let's try to squeeze them in, and then we'll go to our last question and then wrap up. So Ritesh asks, do you think there's still a disconnect from those who create the messages, creative, and media publishers' channels? I find the brand message is not consistent, and therefore building trust over time can be difficult. Has that been your experience?
Yeah, I can I can weigh in there. I think it's there is a disconnect, I think sometimes, but I think things are changing. And I think traditionally creative concepts and branding would always be done very much in silos. So it would almost be happening. And then media agencies or Medscape or other publishing partners would come in and go, right, now you need to refit this to fit something that we want to deliver, and it doesn't always connect. So I think that sometimes doing it in silo means that you're not getting the best out of the creative, and actually being able to deliver it and how you're doing it with your strategy. So yes, I agree.
What can we all do together, this is from Steve, to highlight to pharma clients the importance and possibilities of paid media when so much is possible right now?
I can take a look at a stab, not a look at that. So I think it's changing their viewpoint of seeing media as a cost to seeing it as an investment, and the fact that that investment is going to provide an ROI. And the way to do that is truly through performance data. If you are able to show that the information you're providing and delivering to these HCPs has a direct correlation to more scripts being written, you're going to see that investment continue to grow. And I think that's one of the things that's helped us at CMI grow and be successful, is our partnerships with many publishers like the folks at Medscape here, where the data exchange between our agencies, obviously in a privacy compliant manner, is a big part of what makes us successful. And being able to go and show, hey, this audience segment that we invested X amount of dollars and drove X amount of scripts, which equates to X amount of revenue. And you can set up different tests and controls, right, of who gets media, who doesn't, to actually see the lift that media provides when you have that partnership with your publishers and that data free flowing between the two companies. So it's there for the taking if you do it correctly.
Michael, I know you started your career in media marketing. Do you have anything?
I did. Well, I mean, I 100% agree with Justin. I think we're still certainly outside of the US, and there are constraints with the data sets that we have. But as an industry, we need to get better at demonstrating impact and the outcomes we're achieving. I see a lot of talk about vanity metrics and how useless they are. They're not. I think they're really good indicators. But is it an outcome? Well, no, it's not. And I think we need more maturity in the business, in this sector. I think we've got better at it. I think we see a lot of the agencies like Form CMI, and they're kind of bringing new techniques to us and asking how do we actually kind of prove ROI. I think once you can prove ROI, I think it opens the door. And to the question, that's how you're going to get pharma. That's how you're going to get the senior leaders in pharma interested, if you can truly demonstrate that there's a return on that media spend.
I agree. Just to add in that, I think sometimes in my career, I've seen a lot of people be afraid to talk about sales in pharma. That's the business we're in, right? It's a commercial operation, and actually how we can link that through to prescriptions, I think, is really key. It's not always easy to do it. There's no direct correlation into someone going on Amazon and buying a product, how we do it. But I think pushing the boundaries in how we can show better ROIs is really the way we demonstrate that, for sure. So agree.
We got one more question in while we were answering that one. I think it's a pretty good one, so we'll try and squeeze it in. If we go a little past the hour, then so be it. This is from Jeffrey. How should we as marketers think about LLMs and integrate that into our marketing strategy? What can we do to integrate our messages, and which partners might be there to help us? We've talked a little bit about this already, but yeah, what advice do you have there?
Sure. So I know in the traditional LLMs, a ChatGPT, a Google Gemini, which are probably the two most frequently used, advertising in pharma is not available yet. That's something we are working directly with through our Microsoft partnership and their investment in OpenAI, and then through Google to be there when they're ready. But health is still somewhere that's a little bit tricky. I think what you can do is you can actually look at what or what the industry and CMI are calling GEO, or generative engine optimization. So there are certain things you can do to your content to identify it as it is being analyzed by these platforms to make it stick out. That's a lot of the things that maybe you were already doing from an SEO perspective with Google, using JSON, things like that, to identify certain sections of your website to be keys and be highlighted in responses for LLM. So that's more of what you would coin to like organic search and organic optimization for LLMs. The paid side is not out there yet for the traditional ones. Now, I'd actually love, I know it's new, I'd love to hear from Michael and Liisa. I don't want to put you guys on the spot around what advertising would be available around your new launch, because to be honest, I'm a little bit excited about it.
Yeah. I'm excited about it too. I would say stay tuned. We're actively exploring it. Obviously, we need to make sure everyone's using the tool to the best of their ability, and that it's working the way we want it to, and that it's serving the basic need of getting that information to the physicians first, right? And I think the opportunities for pharma to be a part of that conversation are kind of unlimited right now. So it's all about how we can integrate them into that conversation, but at the same time, make sure that first and foremost, we're meeting the physician's needs and they're getting everything they need out of it as well. So I would say stay tuned.
I'll weigh in just because I was just at an event where we sort of covered this topic. Because the other opportunity for these LLMs is to actually get information about the physicians from them. What are they asking? What are and so I know some of these tools that are being built are thinking about that bi-directional value chain too.
100%. What are people asking? I mean, what do they need? There's a tremendous amount of data that's going to come out from these generative models, and it'll be really exciting how we can, again, use that to make sure that we're giving them absolutely everything they need when they need it.
So we have just a little bit of time left. I'm going to get back into our prepared questions. We really wanted to end with some practical takeaways. So I want each one of you to answer this. If you could choose one thing for the industry to focus on practically to impact engagement, one takeaway lesson, what would that be? Whoever wants to go first.
All right. I got a good one. Go ahead, Michael. You got it.
Thanks, Justin. I mean, this is a simple one, and I gave this question some thought, Jonah. But I really would urge, whether it's agencies or pharma, to really challenge and co-create with your third-party partners everything we've talked about today, with whether it's personalization, segmentation, journey orchestration. I mean, they are all achievable now, and there shouldn't be any excuses. So challenge us and talk to us and push us. That's how we've developed as a business, and I think if we do that, we will produce results that are better together.
Yeah, I'm going to go and say content. To execute omnichannel correctly, where we really started at earlier, I think that's probably the biggest barrier. You can't execute omnichannel campaigns and deliver the next best action well if you are serving the same ad over and over again, right? It actually needs to be reflective to barriers to entry, to spot in the journey, all those types of things. And so find ways to do content more effectively and efficiently than just going and doing some huge brand play with your creative agency partner. The more content you create that is based on data, the better the engagement you're going to have with HCPs.
Kelly?
I think it's about making sure that whatever we're doing, we're setting clear, actionable goals and not just creating more buzzwords, like I mentioned earlier. I think it's about making sure that we're getting the data, we're telling good stories, and we're really tracking how that these campaigns are supporting what the ambitions are. So I think it's just about that, not being afraid to kind of really drill down and go, right, why are we doing this? What are we going to get out of it? And telling that story back. And agree. I agree actually with content and challenge us as well. I think it's not just one size fits all.
I would agree with that. And I think coming back to content, I would love it if more customers challenged us, as Mike said, and said, you know, what do you know? What are your best practices? And I think one of the simple ones when it comes to content is it doesn't have to be complicated to achieve your goals. It doesn't have to be an hour long. It doesn't have to be, you know, 5 pages long. Sometimes clear, concise, simple, very upfront really does win the game, especially when you're talking about an audience that is not time rich.
Well, I think that brings us to the conclusion of our webinar. Thank you all so much for taking the time, for giving some great insights. Thank you, of course, to Medscape for sponsoring this webinar and helping us to put it together. But we really appreciate CMI and for lending their expertise to this conversation too. I think it's been a really good webinar. And of course, thank you so much to our audience. We always appreciate when we get good, interesting questions. We got so many today, and it was really a pleasure to to get to interact with you in that way. Just as another reminder, you can access this on demand if you want to watch it again and get anything you weren't fast enough to write down. If you want to share it with a colleague who you think might be interested in this content, you're going to get an email that's going to tell you how to do that to the email that you signed up for this webinar with. Thank you to Eloise at Pharma Forum for live posting this, and of course Debs at WebMD and Sarah at Pharma Forum for helping to organize on the back end. I hope you've all learned a lot, and again, a big thank you to our panelists.
Thank you.
All right, thank you, everyone.